today doing all things tech. So if you have any issues, she is our assistant director, also with Alumni Career and Professional Development. So if you have any issues, please just direct message her, and she'll be launching the polls and doing all of the fun tech things. Okay, so I want to do a couple. I always do this. Hang on, I'm going to pause and hang on. I'm trying to record. And
Sarah, I've got it.
You recorded. Awesome. Thank you. She's on top of it. Okay, so this is being recorded. It will be added to our YouTube channel. If you are not familiar with our YouTube channel, we have over 70 previous professional development series sessions that you can access, and would love for you to check it out if you're interested in our previous topics. Nina will drop that in the chat. So if you want to subscribe to it and get notified when we have new recordings, this one will be uploaded as well later this week or next week. And yeah, it's just a really great resource. Okay, so I think I went over everything that I needed to. So with that, I want to say I'm so excited to have Swati Shah with us today. Swati and I have worked together for a little bit of time now, and she has developed a really wonderful, thoughtful program and business model around really supporting healthcare professionals around networking and just really thinking about kind of all of the things as a professional. She comes from a background as a physician. I know that she will talk more about that, but I'm just really excited to be with her today and to learn from her. And so Swati, I would love for you to introduce yourself and then kind of take us away.
Thank you, Sarah. Thank you, Nina. Hi, everybody. Thank you for joining our call today. My name is Swati Shah, and I am in New Orleans. I trained at Tulane for my residency in obstetrics and gynecology. And then while I was practicing, I went back to school and did a master's in public health. And then I've done so many things. I've done locum tenens. I've worked as an OB hospitalist. I've worked in public health. And then I went into the pharmaceutical industry. And now I'm taking a break and I've launched my own businesses. My business is PlansConnect. And I believe that we, as people in the sciences, healthcare professionals, physicians, pharmacists, all of the above, nurses, we have so much passion to give. And if you're at a point in your career where you want to look and see what else you can do, maybe it's still in clinical medicine, maybe it's not, but let's build your LinkedIn profile so you can network. And so I'm here to talk about why should you use a LinkedIn profile? What's the value of it? I've got like Sarah said, a few interactive sessions, I mean questions, and then I've also got what do you call it? Give me 1 second to get to the beginning of the slideshow. And I've got a few places you can put your comments in the chat. So thank you all for joining us. I'm really happy that you're here. Why should healthcare professionals have a LinkedIn profile? What is the value of networking online? I've got 3 major objectives. And the 4th point here is that I'm going to do a live demonstration. First, I'm going to define LinkedIn, discuss its purpose. Why is it valuable for you? And let's show some real examples on how we can use it and what it's good for. So first is a pre-knowledge assessment. How many of you actually use social media? It's Instagram, Facebook, Twitter, X, Threads, or there's a 3rd question. I think because the poll is open, I can't show you, but do you have a LinkedIn account that you can log into? And the 3rd question is, how many of you actually actively look at your, use your LinkedIn account and consider your profile up to date?
Okay, so we've got some good responses so far. Can you see those, Swati?
I see that there's 6 out of 7 saying, yes, you use social media. Everybody, well, 7 out of 7 have said that they have a LinkedIn account, and 4 out of 7 said they use it and it's up to date. But a couple of you said, a few of you said, I don't use it or it's not up to date. So interesting. Let's talk about it. And I think there may be a way to share the results. I'm not sure. I closed the poll, and I'm gonna close my little screen of it so I can show you. Oh, here we go. Okay, so these were the 3 questions for whoever's entered the room. And looks like everybody who has answered has said they use it. I'm going to close out this poll now, and it still thinks I'm stuck. Okay, here we go. So name some of the reasons why you don't use LinkedIn. This is what I wanted to discuss. You can just throw some comments in the free chat, or why is it not up to date? What are you all thinking about? And then Sarah can read out some of those comments to me. Has anybody written anything?
Not yet. I'm actually just putting in, I know for me, sometimes as someone who works in this, not sure why I need to use it. Thank you for sharing. Also, I use it, but don't know how to update it for a clinical position, for a non-clinical position.
I also got a direct message on accident that said LinkedIn is sort of annoying and hard to use.
Okay, well, let me see if I can demystify it for you today. This is good to know. So, first of all, let's just go through a little bit of the basics. Let's define LinkedIn. It is social media, but what is it? And how did it come about? And why is it for professionals in their career? Well, these little images are from my personal phone, and I don't know when I took the pictures, but if you look at the little circle, the picture at the bottom that says social, I've got a FaceTime, a WhatsApp, Facebook, my Fitbit's there, there's Zoom, Eventbrite. I don't even remember what the middle one in the bottom row is, but those are all different social medias. I have my LinkedIn separate. And then in my photography section, I have my Instagram, which is another social media. I'm not on Twitter. But if we define social media, if we look at what does Merriam-Webster say, the dictionary? It says it's a noun. It's a form of electronic communication, such as websites, social networking, and other information. You're sharing it in an online community. I am going to minimize this screen so I don't. Wait, what did I do? There we go. Because I was having trouble seeing my own slides. So anyway, so you see it's an online form of communication, electronic communication. Tufts University actually has a statement about it. They said social media refers to the means of interactions among people in which they create, share, and or exchange information and ideas in virtual communities and networks. So this also includes blogs and vlogs. Now, LinkedIn, this is interesting. Back in 2002, some guy decided to create it in his living room, and he officially launched it in 2003. The mission, they just want to connect the world's professionals to make them more productive and successful. It is the largest professional network with over 1 billion members, 200 countries and territories worldwide, so it's international. And its vision is to create economic opportunity for every member of the global workforce. The purpose of LinkedIn is to grow, connect, and share amongst like-minded individuals. It gives you a digital platform to learn, market, and grow your practice, whatever your practice may be or business may be. And it gives you a trusted and reliable environment for the exchange of information and connections between scientific peers. LinkedIn actually vets you. You can have your profile, and the more information you put, it validates you, and you can't just put hokey stuff. You can share your opinion. You can say my dog died today, but I think that's what Facebook is for. Instagram is for what you ate. It's a picture. It's the scenery on your trip, But LinkedIn, for us, I would like to hear who's in the room today, and so I can make sure I tailor this presentation a little bit. I don't know if we have any residents, attendings, physicians, researchers, nurses, investigators, research assistants, medical assistants, pharmacists. Anybody want to put in the chat, and then Sarah can tell me who's here?
Also, before I read those, we had a couple more comments in terms of the like why people have a hard time with LinkedIn, and there were at least two that talked about not sure how to maximize it, and then
Okay.
also switching from clinical to non-clinical, and kind of how to talk about that.
Excellent.
Okay, so we have an attending physician, anesthesiologist, physician, public health professional, administrator at a medical school so far.
Awesome. Okay, great. So there's a whole range. LinkedIn is great for all of these professions in the sciences. Let me share with you who is using LinkedIn. And all of my material in this presentation, I have references in the last slide. So there's over 1 million US physicians on it, over 3 million US nurses, pharmacists, medical administrators, marketers, and you know who else is on it that didn't come up officially in my data, whatever, research? Patients. We're patients too. You can look up, hey, you know what? I was referred to my colleague for XYZ problem. How good are they really? I mean, never mind the Google reviews, because we know you can't really vet those, but let's look at who's on LinkedIn. Is it legit? So why should you use LinkedIn? Number one, speaking of you personally, it's a real-time online record of your accomplishments. Were you the best resident instructor of the year? Were you voted by the nursing staff as one of the best clinicians of the year? You can also identify fellow interdisciplinary connections. Maybe you have work in, for example, HIV, and you want to know what they're doing in other places, such as Lesotho, somewhere in South Africa. That's a country inside of South Africa, if I remember correctly, where there's a high rate of HIV, or Thailand. They have a lot of different programs in public health for prevention. And how do you identify who's doing that work? Well, you could look on LinkedIn. You can also demonstrate your professional competence. You can list your research articles, your pursuits of research, your grants. You can document your certifications. And with that information, you can also attract and recruit interested fellow faculty, interested medical students, other students, PhD students, other residents, people who are interested in the work that you're doing. And then when you get that new group of students, residents, whatever, you'll have someone you can mentor and they can be interested in your work, and it makes for a really good synergy. If I talk about academics for a minute, we have the American Council of Graduate Medical Education core competencies, and there's 6 of those: practice-based learning, patient care procedural skills, system-based practice, medical knowledge, interpersonal and communication skills, professionalism. Clearly medical knowledge that is done in your training. But if you look at these 3 areas, I think your LinkedIn profile can demonstrate that you are accomplishing these core competencies. Some of them are subjective or abstract. They're not quantifiable competencies, and they're useful for not just residents, but they're also useful in evaluating faculty and their performance. If you think about system-based practice, healthcare is not something that you work in as a silo. You need to work effectively as a member or a leader of a healthcare team. You can demonstrate that via your skills and accomplishments. And if you look at the top half of the slide, it's more about the interpersonal and communication skills. You can also engage with patients, or not necessarily engage directly, but they can see what you're doing, and patients will look at it. And if you're documenting your accomplishments accurately, patients will feel good about it and they'll feel more comfortable with you, which is valuable. And even if you don't want to do clinical work anymore, this is also useful at documenting just how you work with other people. It demonstrates your professionalism, your professional conduct. As I mentioned earlier, it's a real-time documentary of your education and career trajectory. It helps you support your professional development and your career growth, because as you keep your LinkedIn up to date, you can see other people's LinkedIns, profiles, and you can attract more attention and explore other avenues. And it also is an opportunity to demonstrate humanism and cultural proficiency. If you speak multiple languages, or you travel or work internationally, or have trained internationally, or maybe you have NGO work, and you can put all of that in there. I have a whole section in my profile on volunteer work. So, and last but not least, LinkedIn also has skills development. There's LinkedIn Learning for free. Whether you want to improve your elevator pitch, which is a workshop I'm doing in 2 weeks on this course, on this webinar series, or you want to do something else, there's some great skills development in LinkedIn Learning section, and it's free. It's totally free. You don't have to pay for it. So now I'm going to switch to real-time live LinkedIn, and then I'll demonstrate a little bit of what I've been talking about, and I'll use my account, and then let's think about some common mistakes, because it's a constant process in which you need to improve yourself. I'm always tweaking my profile. And so, this is something important to know. All right, let's see. Give me a second. I'm going to switch screens. Close window. And then I'm going to share my screen. 1 second here. And here we go. Okay, so this here you're looking at is my LinkedIn profile. First, if you look at the top, you'll see that I have a banner. Why should you have a banner page? Well, it's your cover photo, it's your background. And currently, this is what I want people who look at me to focus on. It could be anything. If you're not sure what to do, there are some generic options. And how do you edit it? You click on the pencil in the upper right corner. If I click on it, I can change my background photo. I can zoom it, straighten it. I can put filters on it. LinkedIn also has some generic ones available. If you want to change it, you could pick one of these custom images, juggling work and family. Maybe you want to have one for celebrating Hispanic voices. When I worked in corporate pharma, I used to change it every month. The company had banners like this with the corporate logo, and depending on what month we were in, Chinese New Year in February, or I can't remember, but different months we have different themes, and so I would use different banners, and it had my company logo. So that's one thing you can do, and it's easy, it's straightforward. Next part is your headshot. You really need a good, solid, professional headshot. It's worth your money. This picture of mine is actually 3 years old. I don't think it looks that different from me, but it's still me. And I think it was worth every penny I paid for it with a local photographer in their studio. You want something that feels like you want it to represent you as a professional. Next section, if you go right beneath that banner and you see the next pencil by my gold LinkedIn button, when you click that pencil, you can edit. I have a paid premium account, but if you don't need to. You can pick how you show your name. I'm not sure if the pop-up screen is sharing. Sarah, do you see the pop-up screen or no?
Yes, it's
Okay.
working. The edit intro.
Okay. Yeah. So you can put your pronouns in. You can have a headline. You can put your current position. You can put your current company in your intro. I could change it and put my current company as this. And then let's see what it looks like if I hit save. And now it says, I think it's in my intro here. Yeah, founder of PlansConnect small event network plan. Oh, here it is. Up here is where I have my company at the top. I just put it above the Tulane University School of Medicine. So you can control what you show. You don't have to have your university. My residency, I finished in 1999. And for a long time, I didn't understand why the School of Public Health was showing up here, because that one I finished in 2009. And if you don't edit it, it will automatically default to chronological order. Other sections that are really good to edit here, there's a section called About, if you scroll down a little more. And in the About section, you put together a paragraph describing yourself. You can use AI, you can use ChatGPT, and you want to describe what are your accomplishments. For example, with my business this past year, or this year in the first 6 months, I've had 2 national scale events, and I'm planning additional ones for next year, and I've generated over 5,000 in revenue. So I've stated what I've accomplished. I probably could edit this more and say I've connected over 100 professionals in healthcare and public health industries, related industries, because I'm trying to demonstrate the success of what I have accomplished. So if you have trained over 1,000 medical students, if you want to highlight your patient skills, maybe you want a different clinical job in another city or state, and you want to highlight your clinical work, your expertise. If you've done research, this is where you highlight it. Write a summary and write what you did and write what you do. Tell them your accomplishments in a brief section here. Don't forget to hit save. I almost did. And then, additionally, you keep going. So how do you pick what you want to demonstrate first? First, you can choose. The default is usually posts. Does everybody see the activity section here? Okay. So you can have posts, events, comments, videos, images, articles. You can even add other things to it. So I have had these events. I probably should have another one. I should have made one for today, but I didn't. So these are all things I could improve upon. And then if I go to posts, I did though post about this today, and this was 10 hours ago. I reposted what Tulane posted about me and our session today. And so if someone looks at my posts, and I think you're on this call, right? This person, I'm tagging you. I forgot who it is. I saw your face on the screen. Okay, so I'm excited you're here. Anyway, so you can repost things from people you follow. If I go back to, now where do I go from here? Oh my God, now I'm stuck here. If I want to go back to me, I just hit my name. Oh, and I double clicked it. I got my banner. So then I go back to my page. Now, me, because I'm starting up a business, I have a featured section, and you can edit what you put in this featured section. I have Congress planning tips. I offer one-on-one services. Okay, this travel event, we did it in June. I can remove it from my featured because, tomorrow's August. So I don't think that needs to be up anymore. But I have a video, a reel I created to talk about who I am, what I'm doing. I could delete this one because it was back in May. This is an article that I turned into a post. So you can do a lot. Highlight what you want to. What do you want it to say about you? And now the next section I have is my experience, and you can edit that with the pencil in the upper right corner again. If you see something that's not there, keep adding to it. If you forgot to put your first research job, let's look and see what do I have in mind, so I can give a little bit of a demonstration. So I'm the founder of PlansConnect. I founded that business in September of 23. I'm also a travel advisor, which I founded in 24 this year, but I changed the order, and you can do that because I didn't want my travel advising to be the primary thing. I'm trying to run 2 businesses, so it takes a while. I'm also available for consulting, and I have been doing that. But then I've also been doing nonprofit event planning since July of 23. And I actually left my corporate job in May of 23. And so if someone goes, well, what's going on? Why are you doing all this stuff? Or, what did you do from May to July? You didn't work. And I was like, well, I did some consulting, but I took some time off. I needed time off. I was working 60 hours a week, and it's okay. Also, my mother passed away earlier in 2023, and after working 60 hours a week for 5 months after she passed, I needed some downtime, and that's okay. And it's okay to say that. It's okay to let people know. You don't have to write it in here, but if someone asks you about it, certainly you can discuss it. But it's obvious I've been busy. So now, if you're wondering, where did all these skills come from? Do you see them in each section? And they're even also in my very top skills section. So here, if you're going back to the About section, you can pick your top skills. You're only allowed 5. If I want to say I want to remove independent thinking because I want to do something else, I could put strategic planning as a 5th skill for me. Maybe I'm thinking that, and then, so this strategic planning skill, where does it apply? I use it at my founder job. I use it in consulting. I use it at many different jobs. So, and what is strategic planning? It's thinking ahead, saying, hey, you know what? I think our company can do more if we maximize blah, blah, blah. And so I hit save, and did it work? Did I save? Yes, I added it. Although it let me do 1, 2, 3, 4, 5. Yes, 5 top skills. And then if you go further down, all my work experiences are here. I think I was on the way to showing you some of that. I've been a hospitalist. I told you locum tenens. I've been in public health jobs here, and I was a full-time practicing physician. So if anybody questions, like, what the heck did Swati do? Like, how did she get into this? Well, there it is. You can even generate a resume or CV out of this. I've got my board certification in here. My volunteer experiences are in here. And you can add sections if you go up here in, I believe, yes. So activity, the arrow by the activity section will demonstrate what you show first. And if I want to change it to articles, maybe you wrote a bunch of articles, and I don't mean scientific research articles. I mean short things. They say one of the best ways to gain exposure on LinkedIn is to write what you know about. So I believe my skill is in networking. And when I had my pharma job, this is what I used to do. So I used to fly around the country and meet with other physicians, researchers, investigators, and talk about women's health. And, I would get up in the morning on Tuesday, fly out, go straight to a 9 a.m. meeting in Houston and meet with people all day long, and then go back to my hotel room at 3 in the afternoon. Whew. And then start over on Wednesday. Maybe Wednesday I'd only have a couple of meetings, and then Thursday I'd fly home. And so, but all of that, you got to, I put all my tips that I found useful. Know where the event is. Plan your exit strategy for your safety. Don't park in a, unsafe place. If it's a meeting, a conference. So I've written these articles. I've also got my business page. So I'll show you that. I have 2 articles in my page, but then when I finally created my business, and then I have my business page, my business coach said, you need to talk about yourself and put more articles in your page so you can grow it. So I have my about section here. I have my location. If I go to posts, then I have articles. And let's see where, oh yeah, no, I shared this. This is my article. What's your elevator pitch? And, you know, I put a little cover photo and I wrote the article. It's not very long. It's a short article, but it's something I think I have something to say about. So I wrote about it. And actually, okay, nobody's commented that they liked it. I'll like it myself, but this is how you get yourself out there. You just have to keep posting, and then there's all sorts of algorithms. And let's see, how are we doing on time? How about if I stop sharing my screen for this part and I actually switch to the slide deck for some common mistakes? Do you guys want to talk about it? And you can put some stuff in the chat. Anybody saying anything yet?
Not just some on the comments so far are really great feedback. Some condolences about your mother and gratitude for the information that you're sharing.
Oh, wonderful. Wow, you guys are great. But you know, it's a constant work in progress. It's not something that's static. It's a dynamic page because you're a dynamic individual. You know, if you really, maybe you go through cancer, chemotherapy, and you have a totally new head appearance or something, change your headshot. It's okay. Maybe you didn't include enough information on your career trajectory, and people are like, well, what did you do? Um, you know, for 3 years between college and medical school. And if you're young, you know, it might be relevant. I took a year off, but at this point, I graduated in college in 1990. Nobody really cares what I did back then. Or I shouldn't say that, but it's not so important that I have it on my profile right now because they want to know what did I really do in the last 10 years. Other mistakes, you can have your friends look at it and see if something isn't as clear to them as it is to you. And I'll just jump here into some Q&A. Somebody ask me a question, please.
So there's been a couple questions, or there's been some comments about you know, transitioning from clinical to non-clinical. And there's actually another comment about the concern of their current employer knowing that they're looking. So I guess kind of two questions there, right? Like, what advice do you have when it comes to LinkedIn of talking about wanting to transition out of clinical? And then also, how do you address that concern of your current employer flagging that you might be looking?
Okay, so there's two things. In LinkedIn, you can put that you're looking for work or not, and you don't have to have that. If you check the box that says you're actively looking, then you'll get a little green banner on your profile picture saying open to work. And that unfortunately tells everyone you're looking for work. So if you don't want your current employer to know, then don't check that box. But updating your profile doesn't mean to your employer that you're looking for work. You could just be updating it to demonstrate your skills, and it makes the clinic look good or wherever you're working look good. Look at how much you've learned from working in that place. And even if you actually think it's not a great place to work, but you did learn something from it, but you don't write that it's not a great place. You write that you learn leadership management skills, negotiation skills, and you can document all your skills that you want to translate into a non-clinical career, whether it's research, cross collaboration. Maybe you were the person who wrote the hospital protocol on we have an anesthesiologist on here. Like, what if you wrote the ERAS protocol and you got buy-in from nursing management, buy-in from the CEO, buy-in from the budget people? That is cross collaboration. And that's also policy writing. Those are all different skills And you should put those as part of your job and document your accomplishments in your current job. It doesn't tell your employer you're looking, but it does make them look good because you work for them and you did this incredible work. And then to transition, you do need to follow the people that you're interested in. You can follow other companies. Would it be useful if I go back to the live section on LinkedIn? I can't see any faces or nods, so is that
Maybe because there's just as you're doing that, there's two more quick questions. So one is what if you aren't clear exactly what you want to do next? And then the other one is there ways to use an existing resume to update your LinkedIn page without hand entering the information?
I'm
I
not
think
sure.
there is.
I'm not sure how to do it automatically, so I'm not sure about that. There may be a way you can scan it in, but I'm not sure.
Also, if anybody else on the call knows the answer to that, please chime in on the chat. But I think there's a way to upload your resume, and I almost feel like there's a way to like have it upload it for you. But if anybody else knows more, please let us know.
Can't remember. It takes time, you're right, to manually upload it. And all my locums work, I've worked at 17 hospitals over 7 years, and I lumped it into locums work. I did not put 17 employers because honestly, I was a 1099 contract employee. So that condensed it. Just to give an example, I feel like I need a refresh of the questions. Can you refresh them one more time for me?
Yeah, so the first one was, what it's more kind of general like career exploration. What if you aren't clear exactly what you want to do yet?
Okay. So if you're not sure, you should definitely explore. So if you could see my screen, you can see this woman, Michelle Varon. I met her at a women's networking event in New Orleans with the Chamber of Commerce. And she was really excited to meet me. And I thought, what am I going to do with a mobility person? And she was like, oh, you're great. And I thought, well, okay, we'll stay in touch. Let me learn more about her business. And in the end, she went to a networking event put on by someone else. And now that person wants me to actually run events for him. So you just never know where it's going to go. But I do think, mobility is important to think about when I mean, I'm an advocate for, the ADA Act. So just because someone's in a wheelchair or handicapped physically doesn't mean they can't come to a conference in New Orleans or whatever. And so therefore, I think her work is important. I'm not sure where the relationship is going to go with me. But then on the other hand, I recently decided to follow this page, the Johns Hopkins, I'm not even sure, Bloomberg School of Public Health Department of Policy and Management. Hopkins was one of it was my undergrad. But I have a friend who's working with this person here. And I thought, oh, health notes influencing legislative decisions. This is something I'm interested in learning more about, following. I may never be involved in writing a health note, but in my spare time or my off time, I do work with advocacy for patients, legislative things, because I'm a big champion for women's health. And so if I know what they're doing, then maybe it can guide my other personal efforts at reproductive rights legislation because they're already doing this. If you're still not sure what to do, you should really keep networking and looking around. I encourage you to go to scientific networking events if you can find them. And if you can't, go to your local city's Chamber of Commerce. There may be a Business Women's Alliance if you're a woman, or even, I know in New Orleans, we have the Hispanic Chamber of Commerce. And then I think there is a Black Chamber of Commerce, and there's one for Orleans Parish, which is the county for those of you not from here. And then there's also Jefferson Parish, which is a county next door. there's different ways to network. There's also online groups to network. If you think you're interested in something, because I've worked, yeah, I think, let's see, these are some groups I'm in. There's a women startup specialist entrepreneurs group that I joined. There is women physicians in industry. I'm no longer actually attending active in the industry, but I'm available for consulting. I'm in the midst of working out a contract with a company, a biomedical device company in another country, and interact, this physician, she's a pediatrician who works in vaccine trials. And I spoke to her after a conference call and I said, I still want to meet you one day. She sounded so amazing with her work that she did. The ASCO meeting gets a lot of interest. I forget which meeting it is. I think it's oncology related. There's other groups. Let's see, what other groups am I in? I'm in a women in public health group. There's all sorts of stuff there. I'm also in music and bands because I love music. I live in New Orleans. There's a reason I live here. I really love music. I love to support my musicians and my chef friends and other things. There's healthcare businesses and professionals networking group. There's also, if you're really not sure what you want to do, there are several podcasts. And I'm going to tell you who to follow. Oh, I got to get out of the group. Sorry. Heather Fork. She's amazing. She's a physician, certified coach. She has her business called The Doctor's Crossing. So when you're at that crossroads in your life, she can help you figure out your next step forward. Coaching does cost money, but listening to her podcast does not. She has several podcasts here and she posts them all online. Once you start following her, LinkedIn will give you suggestions for other people to follow who do similar things. As you can see on the right-hand side here, this physician coach and wellness expert. My friend is Michelle Mudge Riley. She used to be in coaching and now she is actually a medical science liaison. And she is moving and shaking the world, going internationally, working in Europe. So once you follow one person, you're going to get suggestions for other things. And once you have your updated profile, you're going to get suggestions for people in related industries. Sarah, can you go back to more questions? I know there's more I did not answer.
Yeah, so we've gotten a couple about a recording. Yes, Nina already answered that. Oh, somebody did share about a little tip on the question around not having to hand enter the information on LinkedIn. And so there is basically, if you go into LinkedIn and say in the help section, and it kind of walks you through how to upload your resume and do that with your profile. I'm just going back through real quick to see.
I think there was something else. I'm just not sure.
You answered the one about kind of transitioning and how the networking, what you just talked through. Then we had the one about LinkedIn. That's really it. I mean, again, but there's a good amount of comments because they're all very positive and supportive. Okay, wait, let's see, maybe one more came up. All right, so as a pediatric endocrinologist, I've been applying to pharma jobs. No interviews. I'm wondering what I am doing. What do I do wrong, or advice for that?
So 2 things. You need an updated resume and you may already have one. I don't know, but it's always good to get someone to look it over. I am not the resume expert, but I really admire some people who are. Laura McCain is one of them. Jawaria Suhail. I could throw these names in the chat. This woman, her clients get jobs. I don't even know. See, this is the open to work thing I was telling you all about. She's actually really happily employed in a clinic and she's running her coaching business. She's amazing. So, yeah. So, and I don't know about her medical writing, but I met her through some sort of social media, and you know, she's, like I said, she's doing clinical work as an internist and she's really happy, but she's still coaching people and her clients get jobs. So um, that's one person. The other one I really like is this one. She helped me edit my resume when I left my pharma job last year. And then now I have one I work with, but it's the same one that she created, but I edit it and I tweak it. You have to tweak it for every job and highlight different things. Um, Laura will offer those services. She is incredible with her words. Oh my God, she's amazing. Um, and these two people don't even know that I'm talking about them right now. This was not planned. The um So buzzwords are important. And anytime you're applying specifically to a job, whether it's a pharma job or not, you need to look at that company's mission and then tie in keywords from your work or your resume to theirs. Um, and and highlight what you can bring to them and how excited you are for their company to grow. I still believe in cover letters, and I'm constantly posting tips on all these things on my LinkedIn, Instagram, and Facebook pages. You're welcome to follow me at PlansConnect. These are other people who help with coaching or resume writing. Carla Loken. Um, who else helps? I don't remember. There's a ton. And if you're on Facebook, there is a physician Facebook group for non-clinical career hunters that Laura McCain runs and another woman runs, but there's lots of helpful information in there. I prefer to stay on LinkedIn for my professional connections. And I think there's a Dr. Haroon on here who found this webinar from Facebook, and I appreciate you joining me. Thank you. I just think Facebook is more for like personal connections. It's my opinion. All social media is up to you, how you use it. I find that LinkedIn is where where our geeky science people are at. And, look at what Laura has said about herself. I mean, she's such an eloquent writer. She says, as a seasoned pharmaceutical industry physician, scientist, and board certified licensed OBGYN physician, I bring over 12 years of clinical expertise and 15 years of pharmaceutical industry experience. My journey encompasses blah, 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 and consulting. I've successfully contributed to the approval of blah, 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 blah. Providing equitable healthcare empowers women and helps remove barriers that prevent them from reaching their full potential, optimizing outcomes. So she's such an incredible writer. And then look, she even has her journal articles written in here. You can put that. Your employer's not going to know why you're posting your journal articles. If it gets you exposure as a researcher, or even just to demonstrate to the pharmaceutical industry that you are good at R&D, it works.
We've got one more question, two more, but I'm going to do this one because it might be a little bit quicker. Does the algorithm of having more than 500 connections still exist on LinkedIn? I believe this was created for credibility.
Actually, I don't know about the exact number. It takes a while to build your connections, and I try not to accept people who are just spamming me. Um, Unfortunately, because we're in science, all the financial investors seem to think we need a financial planner, we need more life insurance, and I'm so tired of meeting all that. I'm all set. I don't need any more life insurance policies. I have two. And I don't know if there's a magic number, but it takes a while to grow. And I think it's important. I recently made a new friend over Instagram. We share a passion for travel. We happen to both be physicians, but we love food and travel. And we both are Indian women, actually. So, she I pointed out this other profile. I said, have you met this woman? She's an Indian woman blogger. And she said, look at her Instagram page. Those are all bots. She has like fake followers. And there's no way she eats all that food. She can't be in shape if she does. And I was like, oh my God, I didn't even think about all that. I mean, make your connections genuine. You know, it takes a while to grow, but in real life and online, I think it's be sincere. Even if you're looking to get another job and when your employer says, why are you leaving? You say, it's time for me to go. I need to do something different in my career. I'm looking to grow. I appreciate all the lessons I've learned in my career journey here, and I want to grow in a different direction now. And that's not saying anything bad about them. You said you appreciated them. So be genuine in whatever you post or do. Just remember on LinkedIn, they can verify whether it's for real.
This is great. So there is one wait, hang on. Okay. This was asking about a very specific question. So the question is, I want to help a cardiology colleague do pharma work. He has a private practice and was interested in pharma studies. How do I contact pharma companies to pitch us trials for studies with his group? So I also know we only have 4 minutes, so I don't know if this is a question you want to tackle now or take.
So it's a deeper question, but I think, you know, let me pull up the slide deck again and say that you can all follow up with me in real life. I do offer one-on-one consultations, and also I want to do a quick post-assessment survey. So, well, somehow we went to the beginning. That was not the intention. We only have 2 minutes left. Here we go. Play from current slide. So for those of you who have an account, how many of you are more likely to actively use your LinkedIn account? And then wait, Nina, don't put it up yet. For those who don't have an account, would you consider using a LinkedIn account now? And last, would you be interested in a workshop to help create and or update your profile? You can answer the poll. I'll switch slides. These are my references. And this, you can find me on LinkedIn or Instagram or Facebook, but I prefer these two. And I am offering workshops virtually one-on-one, in person at Tulane's Alumni and Career Development Center at the B Fieldhouse. So, you know, I know we're out of time, so thank you for coming, but yeah, I can follow up on that. It's a deeper question with a one-on-one consultation. I do offer those services as part of my business plan. And keep an eye out. We have another webinar, a different kind coming up. It won't be a lecture. It'll be more of an interactive build your elevator pitch session in 2 weeks. Sarah, I'm going to turn it over to you. And Nina, if there's any poll answers on my questions.
Perfect. We will share that out. Thank you, Swati. Thank you so much. Yeah, I just wanted to repeat the pitch for the session in 2 weeks. I know there were some questions around networking and how to build the community, and I think that's going to be a really wonderful opportunity for you all to come and join. Like Swati was saying, it will be more interactive, just so you know. So we will be practicing some elevator pitches. Nina will be in your inbox with all of this information. So Swati's contact, the information about the elevator pitch series or session, and anything else that works. Swati, could we share the PowerPoint also via email?
Yes.
Okay.
Do you want to, I can send it to you as a PDF. How's that?
Perfect. Yep. And that way it'll also be that people can access that as well. You are getting some great comments in the chat. Lots of thank yous. Awesome help. This has been a really great presentation. So thank you for your time, and thank you everyone for being so interactive on the chat as well.
Wow. Well, I'm so grateful. Thank you all. Sarah, if there's a way you and I can stay on just a teeny bit longer, and maybe I can copy some of the some of the messages, I would love to do that. But everybody, thank you so much for coming. I really appreciate your interest, and I hope to meet some of you all again, either in person. If you come to New Orleans, call me. I'm not far from the convention center. I'll meet you for a drink, any kind of beverage.
Perfect.
Coffee.
All right. Thanks, everyone. We'll see you again. Have a great day.
Thank you.